Good afternoon. My name is Babatunde Olatunji. Today I'll be talking about Unit 13 of my assessment, Understanding Mental Health and Coping Strategy, with particular focus on psychological stress. Stress is something that everyone experiences at different points in life. However, the way people experience and respond to stress can be different. In this presentation, I will explain what psychological stress is, some of its main cause, how it affects individuals, and then look at the coping strategies, cognitive behavioral therapy, physical exercise, and social support. I will also compare these strategies and consider which approach may be most effective. Presentation overview. I will begin by defining psychological stress and explain how people respond differently to stressful situations. I will then discuss some major sources of stress, followed by the physical, emotional, cognitive, and behavioral effect that stress can have. After that, I will introduce coping strategies and focus on three approaches: CBT, exercise, and social support. What is psychological stress? Psychological stress occurs when a person feels that the demand placed on them are greater than their ability to cope. An important point comes from Lazarus and Folkman, who explain stress through concept of cognitive appraisal. Their work highlights how a person's interpretation of a situation influences whether they experience it as stressful. For example, two people could both lose their jobs, but react completely different. One person may feel confident that they can find another job, while another may feel overwhelmed because they are worried about money or do not have enough support. This shows that stress is not only about what happened to us, but also about what we understand and evaluate what is happening. It is also important to recognize eustress, which is positive stress, eustress, which is positive stress that can motivate us, compare with distress, which is harmful or overwhelmingly stress. Major source of psychological stress. There are many different causes of psychological stress. One important category is major life events such as bereavement, divorce, moving house, or starting a new job. Holmes and Rahe developed the social readjustment rating scale, which examines different life events and the amount of adjustment they may require. Their original research was published in 1967. Another source is daily hassle. These are smaller problems such as traffic, deadline, financial pressure, or difficulties with colleagues. Although each problem may seem minor, repeated daily stress can build up over time. Other common sources include work pressure, relationship difficulties, financial worries, and health problems. The body's response to stress. Stress affects the body as well as the mind. Hans Selye developed the concept known as the general adaptation syndrome, which describes three stages of body response to prolonged stress. Alarm, resistance, and exhaustion. The first stage is alarm, when the body activates its fight or flight response. Hormones such as adrenaline and cortisol help increase the alertness and prepare the body to respond. Resistance. The second stage is resistance, when the body attempts to adapt if the stressful situation continues. The final stage is exhaustion. If stress continues for too long without sufficient recovery, the body can become physically and mentally depleted. This help explain why short-term stress can sometimes be useful, while prolonged unmanaged stress can negatively affect well-being. Effect of stress on individuals. Stress can affect a whole person in several different ways. Firstly, there are physical effects include headache, muscle ache, muscle tension, tiredness, and poor sleep. Secondly, there are emotional effects such as anxiety, irritability, and low mood. Thirdly, stress can affect thinking and concentration. A person may become forgetful, struggle to concentrate, or find it difficult to make decisions. Finally, there are behavioral effects. Someone experiencing stress may withdraw from other people, change their eating habit, and experience difficulties at work or in education. These areas are connected. For example, stress may affect sleep, poor sleep may affect concentration, and this can create even more stress. Coping strategies, how we respond. Coping strategies are the ways people manage stressful situations. One way of understanding coping is through problems, focused coping and emotional focused coping. Problem-focused coping attempts to deal directly with cause of stress. For example, someone worried about an exam might create a revision timetable or ask their teacher for help. Emotional focused coping focuses more on managing the person's emotional response. Examples include relaxation, deep breath, or talking to someone. Coping can also be adaptive or maladaptive. Adaptive coping strategies are generally healthier and more helpful in the long term, whereas maladaptive strategy may provide temporary relief but can create further problems. Coping strategy 1. Cognitive behavioral therapy. The first category is cognitive behavioral therapy, or CBT. CBT is based on the idea that our thoughts, feelings, and behaviors are connected. It helps people identify unhelpful patterns of thinking and develop more balanced and realistic way of looking at situation. One of its main strengths is that it can help people develop skills that they can continue using after therapy. However, CBT can have limitations. Access to trained therapists may take time, and the person needs to be willing to participate actively in the process. Overall, CBT can be particularly useful when stress is connected to ongoing pattern of negative thinking. Physical exercise. Coping strategy 2, physical exercise. The second coping strategy is physical exercise. This could include walking, running, cycling, swimming, or going to the gym. Exercise can support mental well-being and can provide an immediate change of focus when someone is feeling stressed. Regular physical activities can also support mood and general well-being. One major advantage is that exercise can be relatively accessible. For example, walking does not require expensive equipment or a therapist. However, exercise does not necessarily remove the original cause of stress. It mainly helps a person manage the physical and emotional effect. Another limitation is motivation. When someone is already feeling overwhelmed, finding the motivation to exercise can be difficult. Coping strategy 3. Social support. The third strategy is social support. This means turning to people with trust, such as family, friends, colleagues, or other supportive people. Social support can provide emotional comfort, practical help, and another perspective on stressful situations. Cohen and Wills are associated with distress buffering hypothesis, which suggests that social support can reduce negative impact of stressful experience. One important advantage is that social support can often be accessed immediately and does not necessarily cost anything. However, its effectiveness depends on the quality of person's relationship. Someone who feels isolated may have fewer sources of support. It is also important that support matches what the person actually needs. Sometimes people need someone to listen rather than someone to give advice. Relative effectiveness of strategies. When comparing three strategies, there is no single approach that is automatically best for everyone. CBT can provide deeper and longer term changes by helping people understand and change unhelpful thought pattern, but it may take time and may not always be immediately accessible. Exercise is accessible and can provide relatively quick benefit, but does not necessarily address the underlying cause of stress. Social support can provide immediate emotional, practical help, but its effectiveness depends on whether a person has supportive relationship available. Therefore, rather than relying on one strategy, combining different approaches may be more useful. For example, someone might use exercise to manage immediate stress, speak to friends or family for support, and use CBT to work on a longer term pattern. In conclusion, to conclude, psychological stress occurs when a person feels that the demands they face are greater than their ability to cope. Stress can come from major life events, daily pressure, work, relationship, finances, and health problems. It can affect a person's physical, emotionally, cognitively, and behaviorally. I have discussed 3 coping strategies: CBT, physical exercise, and social support. Each strategy has strengths and limitations. CBT can support longer-term change. Exercise can help manage stress and improve well-being, while social support can provide emotional and practical assistance. The most important point is that coping should be individualized. What works for one person may not work as well for another. In many situations, using a combination of coping strategies may provide the greatest benefit. Thank you for listening. I am happy to answer any question. Thank you.